let's see, 4 minutes after 11 o'clock. When you were little and you found out that some of your friends wanted to become doctors when they grew up, right? You pictured them, hitting people's knees, making their leg jerk out, right? Taking that wooden stick, putting it on the tongue, right? We had no idea when we were kids that there were so many specialties out there. We just thought, that was it. That was before your time, Lauren. Right? Wasn't it? I mean, you didn't have like house visits when you were young, right? Nor did you. Lauren Debick is who I'm talking to. Lauren is in the studio. Lauren, as you know, is the manager of marketing communications at Ocala Health, and Lauren brought a guest with her who may have wanted to be a doctor when he was a kid or not. I don't know. Dr. Christopher Manseau. He's an orthopedic surgeon at the Orthopedic Specialty Care for Ocala Health. Good morning to both of you.
Good morning.
Nice to do. So when you were a little boy, did you want to be a doctor?
Yep.
You did?
Yep.
You knew?
Nice.
I always find that fascinating, that people know when they're little. There wasn't one moment when I said I want to do radio. I never did. I listened to it all the time, but maybe that was part of it,
But you want to be an actor, though, you said, so you have to.
Yeah, I was horrible
Part
at
of
that.
it.
Robin and I did some acting we did a children's thing. If you ever find them, turn it off. Don't look at the whole thing. Don't even look at that. It's like, holy mackerel, I'm horrible. I don't know how they do it. So, how did you become an orthopedic surgeon? How did that happen?
It was an area that I came to, a little bit of my background. I'm a carpenter by trade.
A carpenter by trade?
Yeah, that's how I worked my way through college and medical school.
Oh, wonderful.
Aren't you a doctor by trade?
Congratulations.
I am. Somewhere along the line, I had to earn a living before I could to pay my way through, so that became a carpenter.
Really? And
Nice.
so you do a lot of woodwork still?
Yes, sir.
I bet you do.
Yep,
So this is
wonderful.
your lifetime is carpentry.
pretty much.
So when you retire from you can't be a retired doctor and still dabble in doctoring, or can you?
Not easily.
Yeah. But you can be a retired carpenter and still dabble in carpentry.
Yes, sir.
So that's you. That's you in the future, right?
Yes, sir.
You going to live in the villages or something? Well, thank you for coming in here. What is an orthopedist anyway? What do you do?
Our area of specialty is bone and joints, so musculoskeletal system, so sprains, strains, arthritis, itises, tendonitis, bursitis.
Really?
Yep.
Is arthritis reversible?
Not presently.
No. Okay. How's your right arm, Robin?
Oh, it's better.
She's been
Yes,
complaining
better.
about her right arm. I said, let's ask. We have a doctor in the office. Might as well ask him. So, and how do you diagnose pain? Like, how do you can you always see it, like with an X-ray or ultrasound or one of those things?
Most of the time, it's actually by history. You talk to the patients.
Really?
Yeah, it's a little old school, but it still works really well. You find out where they hurt, how they hurt, what makes them worse, what makes them better. And then all of those are crucial to coming up with both a diagnosis and a treatment plan for them.
Wow. So do you ever not find a piece of evidence that would give you an idea, and then you find it out? Like, let's say you were talking to Robin about her right arm. Use her as an example. And she never told you that she plays mandolin and has to strum it and strum it and strum it and strum it. And then all of a sudden that comes up. Does that tell you, oh, well, that might be it?
Yes.
Oh, my God.
Psychology. Well, when you are diagnosing patients, do you try to find treatment in lieu of surgery?
Yes. Over half our patients never enter an operating room. So we really,
Well, that's good.
our focus is really trying to keep people out of an operating room, and they end up in an operating room when nothing else works. So it's not the first place to start, it's the place you end up when nothing else has been successful.
And I've heard from people saying that they have to get surgery for their rotator cuff. I don't even know what that is or anything, but they say that's when your shoulder droops and they've got to get it fixed. How does that happen, that it gets out of alignment?
Well, rotator cuff problems or shoulder problems in general are complicated to say the least, but they're usually accumulation of small injuries over many years. Usually just the wear and tear of time for most of our patients, certainly in Ocala. The younger patient more commonly is a traumatic injury, fall, motor vehicle accident, something like that. But the majority of my patients come in and say, I was lifting a pot of coffee and my shoulder, I felt a pop, and now my shoulder is killing me. And that's a much more common way for presentation for somebody with shoulder pain here. And that's just basically it's something they develop over time, and I affectionately call it the postage stamp effect. So they get a series of small injuries over time that weaken the tendon, and then they have one event which is relatively minor, and it's the straw that breaks the camel's back,
okay, right,
and then it
right.
lets go. And then they're in a situation where they're not able to raise their arm, or they have just pain that's just unbelievable. They can't sleep at night, they can't get dressed, they have troubles doing their hair, and those are the patients that end up getting rotator cuff surgery usually, because they're just very dysfunctional.
Wow. Well, how long do they usually wait before they ask you for help? I would imagine if it happened to me, please, dear God, don't let it happen to me. But you don't mind if I pray and everyone. So, I mean, do you find that people say, I've been taking an aspirin for the last 2 years or the last 2 months? How long do they usually wait?
That's quite variable. Some patients are extremely pain tolerant and or just truly stubborn, and they'll just put up with it for a long time, 1 or 2 years. But the majority of the patients we see, it's 1 or 2 or 3 months, and then they just get to the point where they're not sleeping, and probably more importantly, their spouse is not sleeping because they're miserable, they're keeping their spouse up all night. So usually it's the spouse that's dragging them in, saying, hey, fix this thing because I'm not living like this anymore.
Wow. So they sleep through the pain?
No, they generally don't.
I see.
Which is why the spouse is not.
I was going to say, kicking is. Oh, wow. Okay. And is it usually the shoulder? It's usually the big ones, right? The shoulders, the knees?
Yes, sir. Bigger joints cause bigger problems. Hips and knees in particular are usually much longer. They're slower. Most of the disease processes that occur there are arthritis related, are very slow. They'll take years to develop. There are more acute injuries in knees, especially where the meniscus injury, which is a disc of cartilage between the end of the femur bone and the top of the tibia bone, those can tear, and they'll cause you very acute pain and really limit your function very quickly. And fortunately, treatments for those, we usually start with a simple cortisone injection, and most of the time that will really get the knees to calm down. Some patients truly have mechanical problems where the knee is locked or stuck in one position, and those end up with surgery very quickly because they're very dysfunctional.
Do you see a lot of women after they have babies complaining about their shoulders, mostly because they're carrying diaper bags or carrying babies on one side?
Not as much of the shoulders as much as it's the wrist and the hands. They're prone to some pretty frustrating tendonitis issues from picking the child up. That and new grandmothers are usually from picking the babies up. They'll get a pretty bad tendonitis in the wrist and
What
hand
happens
area.
to Grandpa? He doesn't pick the babies up?
Not as much.
I'll be picking them up all the time. My son and his wife have a baby. I will be a pain in their butt. Okay, so let me ask you about repetitive use, like you or a carpenter. You're
Yes, sir.
using a hammer. I'm just going to, I don't know who you do, but. I mean, does repetitive use, like with the wrist, is that, because if you're picking the baby up, that's repetitive use, right?
Yes, sir, it is. That's exactly what it is. It's just this repetitive motion that you're doing that you're not accustomed to doing.
Oh, okay. But in your case, with the hammer, you've been doing it since you were a kid.
Pretty much.
So you can work up to it?
Yes, sir.
And then prevent the injuries?
Yes.
Oh, okay. So when you get a grandchild, once a month maybe, and then pick it up twice a month?
It's actually, it's more commonly things like changing the diapers and picking the child up for distant care.
When you diagnose a patient with tendonitis, is that curable?
Yes, that's very treatable.
Really?
Yes, sir.
Wow.
Most commonly, we find simple treatments like anti-inflammatories, Aleve, ibuprofen, naproxen are really good places to start with those. As long as the patients can tolerate those, are very effective in treatment of acute tendonitis issues. More importantly, it's mostly resting the area that's hurt. If the tendon is inflamed, it needs to be rested for a while, either with a splint or just crutches if it's a knee or a leg, just to protect them from motion until the inflammation has a chance to calm down. Sometimes we'll use oral anti-inflammatories. In addition, like steroids, prednisone in particular is probably the most common one we use. In the most severe cases, cortisone injections are very effective treatments for that. Very rarely do tendinitis issues get operated on unless they're just nothing else has worked.
Are you a fan of those special pillows that you see advertised on TV with the grooves and everything in there for sleeping on?
I think it's more about what you find comfortable.
Oh,
I don't think
okay.
there's one pillow that is perfect for everybody. I think everybody has their
I
own.
can make any pillow perfect. I do. I take every pillow, just push it up together, and there's the spot. There's my spot.
Exactly.
Am I alone in this? Does everybody do this, Lauren? You do it, right?
I do. I have pillow
That's
placements.
that's a Facebook picture. We should all take pictures of our pillows when they're in the perfect position.
Oh, that's a good idea.
We should do this. I'll start it.
Started.
I have an app for that or something. Dr. Christopher Manseau is our guest. He is Lauren Debick's guest, actually, from Ocala Health. And Dr. Manseau is an orthopedic surgeon. If you have any questions, the phone number to call right now while he's here is 622-9622. Can I have kind of a language question? It's more of a language than a real medical, I guess, unless you take it and it makes it medical. We have doctors all the time in here, and I know a lot of the words end with itis or osis. So it's more of like the word guy I am. Is there a definition for the two endings, the two suffixes when they're the ending of a word? Yes?
Well, an itis is technically an inflammation, and it usually refers to, in tendons, it usually refers to the lining around the tendon. So that sheath, if you would, that the tendon runs in becomes inflamed. An osis is an actually deterioration of the tendon itself. The body of the tendon becomes damaged, either because of a lack of blood flow
Oh, really?
or injury. Yeah. So there's
such thing as tendinosis?
Yes, sir.
Oh, wow. And that sounds worse if it's deteriorating.
Yes, sir, it is. It's what we see prior to failure or rotator cuff tears. It's more common.
Okay, so if an itis is an inflammation, now it's another word question, is it, like when you see something advertised as an anti-inflammatory, do those things work?
Yes.
Yes. But is there an asterisk there?
No,
No?
they're, as long as the patients can tolerate them, and as long as they can get a sufficient dose, they're generally very effective in treatment of the itises, if you would. The osis, which is the actual physical deterioration of the tendon, is a little more complicated because the anti-inflammatories don't affect that. They don't aid in the
That
healing.
wouldn't help at all. But you as a patient wouldn't know unless your doctor diagnosed it, right?
Right, and actually, they're more commonly diagnosed by studies like MRIs and things like that. The deterioration of the tendon we'll diagnose it as an itis, but the MRI scans will diagnose it as an osis.
And is carpal tunnel, is that part of what you do?
Yes, sir. Surgery we
And
do.
what is that? What category is that? Is it inflammation or?
It's actually a compression where the nerve itself is being.
Oh, that's neither.
Exactly.
Okay, okay.
When a tendon deteriorates, are you able to replace the tendon or put in like a splint or something to help it out?
Generally, yes, we're able to rest it. We'll use the cortisones and things like that to rest it, to calm the irritation of as a result of that injury to the tendon. Sometimes they'll heal. It depends on that individual person's biology as to whether or not they can heal them. Those that don't end up healing will end up will end up with having surgery. If the tear is small, they're usually repairable, and that usually a minimally invasive arthroscopic procedure is what we choose there. Sometimes open procedures if they're slightly larger injuries, and then if it's a non-repairable injury, in other words, if their tendon's been torn for a long time, the tendon will actually deteriorate to the point where it's not it's just not there anymore. Then there are other surgeries that are done, and those are in the form of shoulder replacement surgeries.
Wow.
And those
What do you replace it with?
well, it's called a reversed total shoulder arthroplasty, and it basically it's the reverse of what we're given naturally. The humerus, which is the long bone in the shoulder, it has the ball on it, and then the socket is usually on the shoulder blade. In a reverse, we actually put the ball on the shoulder blade, and we put the socket on the humerus.
Oh my gosh. And it's made out of plastic or something?
there's a plastic portion of it, but the majority of it is actually either titanium or a material called cobalt chrome.
And now, what kind of exercises do you prescribe to the person to keep surgery from happening?
Typically, for most patients, it's in the early stages of recovery, we focus more on flexibility. So getting back the motion back in the shoulder first. And then once a patient has their flexibility back, then we usually get them involved with a physical therapist to get them a structured exercise program that addresses their individual weaknesses, if you would, in the shoulder.
Do you know you look like James Taylor? Did anybody ever tell you that? Doesn't he look like James Taylor?
You do, and you have the best eyes. I must say, your eyes are really a fabulous attribute.
Well, thank you.
Have you seen Fire and Rain?
Best eyes.
Yeah, that's James Taylor's song. Nobody got it, did they? you know, James Taylor doesn't do, well, he does do woodworking, I think, but he plays the guitar made out of wood. So. Have you ever made a guitar?
No, sir.
Oh my gosh, that'd be awesome, wouldn't it? Made a guitar?
be.
Do you play the guitar?
Not well. Play the clarinet.
You play
Clarinet, nice.
Oh, we saw some kids playing clarinets outside Publix the other day. They were raising money for something.
For the Lakeware High School.
Was that
yeah.
what it was? Like, where has it?
Yeah. When a person, does a person come to you first, or do they have to be referred to you by their general physician?
We don't require a referral for patients to come see us. The only patients who require a referral are those that are in the HMOs, that they always have to come through their primary, but that's dictated by their insurance. It's not our requirement at all.
Oh,
Is
my
there
gosh.
ever, I guess this is a stupid question, I guess, but anyway, is there ever such thing as the emergency orthopedic surgery?
Absolutely.
All the time, so that would be like a car accident or something?
Yes, sir, or patients, falls or accidents. You know, I do a lot of upper extremity work, so patients put their hands in table saws and all sorts
Oh,
of.
my.
Oh, don't ever do that.
Nope.
Oh, my.
I
Nope.
mean, you work with table saws all the time,
Yes,
right?
sir.
Does the vertebrae count in what you do also? Do you, is that, added on to the shoulder surgery that you do, or is that separate?
Usually spine surgery, which is, that's a separate area of specialty. We do treat patients conservatively for spine problems, usually seen in conjunction with the shoulder complaints. But true spine surgery or for neck problems or back problems is usually best managed by a spine specialist, either a neurosurgeon or an orthopedic surgeon that does spine surgery.
We're up against a break, and so let's take that break. We'll be right back. Oh, let me do the phone call first. I'm sorry, I have a phone call. Doctor, if you'll put your headset on, you'll be able to hear the caller. And so we'll do this before we take the break. Hopefully I didn't disconnect anybody. Good morning, you're on the air. Thank you for calling.
Yes. I have a question for the doctor concerning the knee replacement, arthroplasty, I guess, the pedal knee replacement. After surgery, if you have a lot of pain in your foot and ankle, is that related to the surgery?
It's not uncommon for patients after knee replacement surgery to have pain that will go down the leg. It's not terribly common to go to the foot, but we have had patients with it. So normally it's something that your orthopedic surgeon should be aware of, and it's something that they should be following. Usually as the knee heals and as you recover your function, that should get significantly better.
Okay, yeah, I'm having that experience. I will be talking with my doctor about that.
Okay.
It's very painful. Okay, thank you.
All right, thank you. I apologize. We had a hard time hearing her. Did you guys have a hard time hearing her? You understood what she said, though. So the recommendation would be what? To call you, Lauren, and set things up?
Well, for that particular one, probably talk to her orthopedic surgeon, whomever that may be. But if anyone has any questions, they can certainly call our health hotline. It's 1-800-530-1188.
Okay, let me do this break here real quickly, and then we'll be right back. The phone calls are still welcome, by the way. You're invited to call. The number is 622-9622. When we come back, we'll make sure that Lauren gives out the information so that you can call directly to Dr. Manseau or to Ocala Health, of course. Let me do this. We'll take a little break. We'll be right back. So I find my button here. Here we go.
Hi, this is JP from Penn Flooring here in Ocala. I would like to invite you to come in and visit our spacious showroom where we have solutions for every style and budget. From wall-to-wall carpet to hardwood floors and tiles, we have an unsurpassed selection of flooring. At Penn Flooring, we've provided quality customer service with a family touch for over 25 years. Visit our website at pennflooring.com or come by our showroom, 1201 Southwest 17th Street, just over the bridge. Penn Flooring, quality customer service with a family touch.
Palm Garden announces Fast Track. Fast Track, focused assessment, safe transition. When a new guest is admitted to Palm Garden, we start with the ABCs. A is the assessment to determine what the guest needs. B is for basic care, which is excellent nursing and therapy. And C is for consistency to provide what's needed throughout the stay. Fast Track. Palm Garden will get you home fast, really, really fast. Take a fast tour of Palm Garden located at the corner of Southwest 27th Avenue and 34th Street.
Attention veterans with dental needs. Dr. Chris Bonesteel is once again giving free dental care to all veterans on November 10th. What Dr. Bonesteel is offering are cleanings, fillings, and extractions at no cost to the veteran. What the veteran has to do is call Vets Helping Vets at 433-2320 to make an appointment. The program starts at 8 a.m. and ends at 3:30 p.m. So if you are a vet in need of dental care, call 433-2320. That's 433-2320.
During the break, I showed Lauren James Taylor's photo. And yes, you look like Dr. Manseau looks like James Taylor a little bit. You just got to get a guitar and... Hold on, let me get your picture back on here. Right now, I got James Taylor in there. Let me get Dr. Manseau back on
Dr. Manseau, you had mentioned golf during the break. Is that shoulder pain and joint pain an issue for the golfers?
Absolutely. It's actually one of the major complaints for a lot of my older patients coming in, that they're no longer able to participate, particularly in golf. And so the focus is very much on getting them back on the golf course. And the majority of them, it's just simple treatments. It's more commonly simple injections, a little physical therapy, and they're back enjoying the game and having a better quality of life. Some of them, it's a little more complicated. They have injuries to the rotator cuff most commonly, and those will end up with surgery.
So baseball players are probably the same thing then, because they're really hitting a lot of poundage out there when they swing.
Yes, actually, throwing is actually more problematic for them than...
It's amazing when you look at a photograph of a pitcher. That looks unnatural. The way that arm is looking, right? When they get that still, right?
Yeah, the motion of throwing a ball it puts a tremendous strain on the shoulder. The shoulder is the most unique joint in the entire body. It's the most flexible. It has the most range of motion of any of the joints in the body. And the analogy is like trying to balance a baseball on a golf tee. And so the shoulder has a lot of soft tissues that keep it in place. So you can easily, and in our throwing athletes, we tend to not see as much rotator cuff problems as ligament problems. So the shoulder tends to be unstable. It slides in and out of the socket, and that creates pain. But it eventually, if it goes on long enough, it will lead to a rotator cuff injury or tear.
So a lot of what you do is sports therapy as well.
Yes, sir.
Treatments, okay.
And so you have a lot of preventative exercises that people can do then.
Yes.
To decrease their chances of getting this injury.
Especially in our athletic population, whether it's my 13-year-old or whether it's my 60-year-old, we do focus a lot on well care, on really giving them the tools both to warm up properly, to stretch properly, to keep their shoulder strength and balance in the proper conditioning to be able to allow them to continue to play the sport and avoid injury. That's a lot of our focus, especially on our younger athletes. I have a large group of kids that are playing 13s in their early teens that come in with shoulder and elbow problems that don't need surgery, but they do need direction as to what's going on for them and what they can do to get them back on track.
And you give them information to prevent it in the future?
Yes,
Yeah.
we give them a more structured program. We give them an exercise program and a stretching program, and we also give them very significant restrictions on, especially while they're hurt, on the number of pitches that they can throw and the number of times, and really get them back to being a normal adolescent.
Do you remember the hockey player Gordie Howe? He died last June, right? We had his son on yesterday. His son wanted to be a hockey player, but wasn't as good as his dad, and he's actually into sports medicine. That's what he does. What is he, in California?
Yes.
Where was? Yeah, I think so. So yeah, so you have something in common with, what was his first name? Something Howe.
Maury
Howe?
Maury Howe, yeah.
Maury Howe.
Excellent. You really are providing a great service to the community, Dr. Manseau, because sometimes people will have a pain, and like you said earlier, they'll start to ignore it, but as long as they're aware of it, they should come and see you so it doesn't get any worse.
There's an opportunity to feel much better and to enjoy your life. Our philosophy is you're either going to adjust your lifestyle to accommodate the limitations of your shoulder, or we're going to help you get your shoulder back where it should be so you can enjoy your lifestyle. And it's about restoring your quality of life. And whether you're 13 or you're 80, it doesn't matter. It's about quality of life and the time you have.
I always wanted to meet James Taylor. Do you show your wood at all? I mean, do you, like at a wood show? That didn't sound good. I mean, what's that thing we're doing tomorrow? First Friday Art Walk?
Yeah.
Holy mackerel. Lauren. Can I edit that out of there? Sorry. I mean, do you ever show it?
Mostly what I do is...
a lot of times I do stuff like that on purpose, but this time, I promised. I wouldn't go. That's like over the envelope. I just stay behind it.
Mostly what I do is I do cabinetry work, so I build tables and cabinets.
I bet you.
Oh, that's wonderful.
Christmas presents. You get a lot of people getting wood at Christmas.
Nice.
Okay. You know what I'm going to do? I'm going to end with James Taylor song.
Which one?
I think it's Up on the Roof. Do you know the song? Up on the Roof. He didn't write it. Let me see.
I love the fact, Dr. Manseau, that you really are so passionate about this. Your passion comes through and you're caring for others.
Well, thank you very much.
You're welcome.
Thank you so much. Lauren, give us a phone number so we can find out how to get more information.
The number is 1-800-530-1188.
And can we reach
Thank you.
Dr. Manseau through that number too?
Yes.
Okay.
Ocala Health. Lauren, thank you for bringing us great guests.
Thank you for having us.
And one more thing I wanted to say, that we've had quite a few guests that are like herbologists and things like that, and I've often wondered, I would love to have you in the studio one day when we have somebody talking to us about, what was that stuff I put under my tongue? It didn't work.
Oh, gosh.
Oil of oregano.
That's it.
Didn't help at all.
Yeah.
I would love to have you in the studio before I go spend $25 over at the health food. All right, we will be right back. Thank you so much.
Thank
Feeling tired and beat. I won't go up where the air is fresh and sweet. I'll get far away from the hustle and crowd and all of that rat race noise. I'm in the street. Oh, Lord.
Hi, this is Brad. I want to take a moment to talk about a serious issue. In the next 5 years, the aviation industry is projected to have a shortage of commercial pilots. Now is the time to start training. Ocala Flying Club has started a scholarship for the youth of Marion County ages 17 to 24. The club will donate up to $4,000 towards a pilot's license. This will help get the student on their way to obtaining their commercial pilot license. If this sounds like something you would be interested in, or if you know someone that would be, please contact Ocala Aviation Services, 861-7484.
Veterans Day in the U.S. is also known as Armistice Day in other parts of the world, and it honors the many military who have fought for freedom. It is also the anniversary of the signing of the armistice that ended World War I. Major hostilities formally ended at the 11th hour of the 11th day of the 11th month in 1918. The folks at the Voice of South Marion join you in remembering military past and present.